Well, just yesterday, the CDC advisory panel voted 15-0 to recommend the COVID shot to the Vaccine for Kids program, which is a federally funded program that provides the shots at free of cost. And just now, we are learning just moments ago, they recommended it to be added to the childhood vaccine schedule. And so we want to talk more about this. I want to bring in Dr. Peter McCullough, and a cardiologist, an epidemiologist, and author of Courage to Face COVID-19. Dr. Peter McCullough, thank you so much for being here.
Thank you.
So the CDC advisory panel goes ahead and recommends the COVID-19 shot to the childhood vaccine schedule. This happened just moments ago. What do you think is going to happen next? Because a lot of parents are concerned, because when the CDC advisory panel makes a recommendation, then the CDC goes along with it. And what does it mean for blue states like California and for kids going to schools?
I think it means that parents are going to carefully look at vaccines and select away from receiving the COVID-19 vaccines. None of the people on the committee, either yesterday or today, provided any assurances on short or long-term safety. This is very important. The vaccines, the FDA warns parents that they cause heart damage or heart inflammation. They also cause blood clots and neurologic damage. The members of the committee did not address safety whatsoever. The vaccines are not medically necessary because most children have already had COVID. And then if they get it again, it's a characteristically mild illness. And they're not clinically indicated, since when COVID-19 does occur, children have benign outcomes.
Yeah.
So I think this choice will be selected away from the schedule by parents.
Well, we do hear a lot of stories of young people suddenly dying. Shouldn't we be looking into this? I mean, you talk about myocarditis as a side effect. And what gets me, Dr. Peter McCullough, is when, we started first hearing about myocarditis, it was framed as just mild cases of myocarditis. Myocarditis is not mild.
You're correct. Most of the serious reporting on this, including those by Tracy Hogue and others, have reported that 80 to 90% of the children are hospitalized with this. This is a very serious condition. Hospitalization, by definition, is a serious adverse event, and we know it can cause fatal cases of myocarditis. Patone and colleagues recently in Circulation reported on 100 fatal cases. So parents are losing their children due to myocarditis and heart damage. It forms a scar in the heart, and then the children suddenly collapse and many times can't be resuscitated. What's very alarming is at least half of these cases are subclinical, meaning the children don't feel the heart damage, and the first manifestation is sudden death.
What is the justification for even pushing this on kids? And what is your analysis of those who are sitting on, the CDC advisory panel? Let's say there's 15 doctors. So 15 doctors get to say what the entire nation should do, and then the CDC itself?
There's no justification from the children's perspective. I think this is a fear-driven, distorted attempt to use children as human shields, in a sense trying to have the children immunized to protect others. The vaccines don't reduce spread of the virus. Fully vaccinated people spread it to fully vaccinated people. It's a mild illness right now. The entire vaccine program should be dropped. I think parents should decline this one for the children, keep them safe.
Dr. McCullough, I think the concern for parents in states like California, it's like you might not be able to have an exemption if it's added to the schedule. So it's like in order to attend the school, you will have to get the vaccine. But I know parents aren't going down easy on this one. There's lawyers who are going to be lined up to take this to court. Also, California Governor Newsom, as you know, recently signed a bill that will subject doctors to discipline and possible suspension of their license for spreading, quote unquote, misinformation of the COVID-19 pandemic to patients. I mean, so he's now muzzling doctors as well?
Californians will need to step up. So the mothers and fathers will need to push for their constitutional rights to have their children receive education if they don't take a vaccine. And then California AB 2098 is unconstitutional. In 2018, the Supreme Court guaranteed doctors the right to free speech in their practice. And this California bill clearly violates the Supreme Court ruling. Doctors Barkey and McDonald are suing California. The California muzzle law has not gone into effect yet. It goes into effect January 1st, 2023. So Californians need to step up right now, protect their children. and protect patients so they can get a fair set of medical opinions and second opinions from their doctors. Patients don't go to doctors to get government narratives or to get government-provided vaccines. They go to doctors to receive medical opinions and proper care.
You know, the CDC advisory panel, from what I understand, will also take up the issue of shielding Moderna and Pfizer from any vaccine injuries. I know they're now covered under the public health emergency, but then it will just completely shield them. In addition to this, they're pushing this on kids as well.
The vaccine manufacturers have reaped billions of dollars of profits, and they need to be responsible for vaccine injuries. The Vaccine Compensation Injury Program in 1986 and current liability shields for the manufacturers should be dropped. This should be done under executive action or congressional action. And the vaccine manufacturers need to disclose data to the public on vaccine injuries and deaths and then compensate the victims.
What's disturbing, Dr. McCullough, is that Big Pharma comes out with their press releases about how, the shots are working, and then, they just pass on the information to us, and we're not even really allowed to ask questions. The interesting part, too, is the latest boosters, less than 4% of the population got it. You wonder why.
It's true. The boosters failed. The bivalent boosters failed in animal studies. They didn't stop COVID in the animals, and they provided a false surrogate rise in antibodies. And the FDA went ahead and approved these because they were already pre-purchased. The US government already bought these before the failed animal studies were reported. This is complete and total regulatory and government malfeasance. Americans should be outraged. The bivalent boosters should be taken off the market. We should never have a product that's never been tested in humans then applied to Americans. It's not safe. It's not responsible.
Absolutely. There is no justification for this. Dr. Peter McCullough, as always, thank you so much for joining us and your insight.
Thank you.
For all our viewers asking where One America News is heading in the future, we would like to introduce you to OAN Live. OAN Live is the best way to stay up to date on all of the hard-hitting, straight-shooting, national and international headlines. And the best part is, OAN Live is only $4.99 per month. All the credible, honest, unbiased reporting One America News offers at a fraction of the cost of cable. Just go to OANN.com to easily sign up for OAN Live and stay informed.